Patient harm doesn't just happen when care or treatments given to the patient results in harm. This could be wrong site surgery, like removing the healthy kidney instead of the diseased kidney, or given the wrong dose of a medication. Patient harm also happens when care or treatment isn't provided because the diagnosis is incorrect, delayed, or missed completely. That is what happened with our 19-year-old son, Vance. After a single motor vehicle accident that resulted in a suspected head injury, Vance was sent to our closest tertiary care hospital, where he was given a CT scan and admitted to the surgical intensive care unit as a precaution for observation. We were told, "Your son just has a minor injury. It's just a concussion. It's going to take time and rest." We're told this frequently over his 4-day stay. Unfortunately, though, from his admission to the time he crashed, Vance was not given the care that would have given him the best chance of survival. I voiced the concerns I had many times to the staff. I was alarmed by his decreased level of consciousness, the change in his vital signs, and his overall condition. At the time, as a nurse with almost 30 years' experience, I knew this was more than just a concussion. As Vance's mom, the one who knew him best, I knew something was terribly wrong. I could not get anyone to hear my concerns. When I questioned his increasing aggressive behavior, I was told, "He's a rig worker. We expected that." When I mentioned how low his pulse was at 37, I was told he's young and in good shape. When I brought forward his periods of apnea, I was told he was practicing deep-sea diving breathing. Vance had never even been to the ocean, let alone done any deep-sea diving. When I noted seizure activity, I was told, "No, it's just tremors." I asked for a repeat CT scan, given Vance's deteriorating condition, but I was told it was not necessary because it's just a minor injury. I was watching my young, hard-working, brilliant, blue-eyed son die before my eyes, and I could not get anyone to see what I was seeing. What caused this diagnosis error when Vance's admission CT showed the following injuries: a right and left frontal contusion, a right and left temporal contusion, a parietal contusion, a basal skull fracture, a right sphenoidal fracture, a linear, temporal, and occipital fracture. How could this be interpreted as a minor injury? Was Vance's head injury ignored because of provider bias? Was he stereotyped as just another young man who was involved in a motor vehicle accident because of drinking and driving? Except it wasn't. There was no alcohol involved. His serious head injury was missed or maybe ignored, so he wasn't put in an induced coma. He didn't have an interventricular catheter inserted to measure his intracranial pressure. He was left to deteriorate and die without any intervention in a big, modern Canadian hospital. He ended up with a subarachnoid bleed, severe brain swelling, and eventual uncal herniation. It never should have happened. We want lessons to be learned from incidents like Vance's. Some of those lessons are: leave your personal biases at the door. Discuss the test results, CT scans, x-rays, blood tests, etc., with the patient and family. Maybe if someone had discussed the CT scan with me, things would have been different. Maybe by verbalizing what was on the CT scan, the staff would have realized, and I would have known for sure, that it wasn't just a minor injury. Discuss what symptoms can be expected going forward so that we're aware. Listen to and hear patient and family concerns and address these concerns. Have complete communication between staff members. Never, ever dismiss the concerns of a mother. We want learning from diagnosis error and Vance's incident so no other family goes through what we have. Patients for Patient Safety Canada wants to highlight that diagnosis error is a concerning cause of patient harm. We want to work with the healthcare community and the public to educate, evaluate, and elevate the knowledge about diagnosis error so that every patient is safe.